He woke up this morning and had nobody to text. Not because his phone is empty. It is full of names, colleagues, old university friends, a brother in another city, a mother who calls on birthdays. But there is a difference between having people in your life and having someone in your life. And tonight, like most nights, he will eat alone, watch something alone, and fall asleep, wondering why. He feels like a stranger inside his own existence. His name does not matter, because across Europe right now, in flats in Berlin, in terraced houses in Manchester, in apartments in Paris and Stockholm and Warsaw, millions of men are living this exact same morning. This is not a story about dramatic collapse. There is no rock bottom here, no addiction, no visible crisis. This is something quieter, and in many ways, far more dangerous. This is the story of the loneliness epidemic, hitting men in Europe, and almost nobody is talking about it. In 2022, the European Commission did something they had never done before. They asked 25,000 people across 27 nations one simple question: how lonely are you? What they found was not what anyone expected. Approximately 30 million European adults report feeling lonely, frequently. That is not a rounding error. That is the population of an entire country, feeling alone, right now, on this continent. But here is the part that does not make the headlines. The people reporting the highest levels of loneliness in Europe are not the elderly. They are young adults, specifically young men. A 2024 study by the Bertelsmann Foundation found that 57% of young Europeans between 18 and 35 are moderately or severely lonely. In France specifically, almost 2/3 of young people are affected, 2/3. And Gallup data from 2024 shows that in countries like France and Ireland, at least 1 in 4 younger men say they feel lonely on a daily basis. Not occasionally, not sometimes, every single day. These are not men living in poverty or in crisis. Many of them have jobs, some have relationships, several have hundreds of social media followers. And yet, something fundamental is missing, and they cannot name what it is. To understand why men are being hit hardest, you have to go back to the beginning. When boys are young, friendship is physical. You wrestle, you run together. You sit close without thinking about it. There is no performance, there is no script. There is just being together. But somewhere between childhood and adulthood, something is taken away, quietly, without announcement. Boys are taught, not always in words, often just in the reactions of others, that emotional closeness between men is suspicious. That asking for connection is weakness. That needing people means you have failed at being a man. And so by the time most European men reach their 30s, they have become experts at performing connection without ever actually experiencing it. They know how to talk about football, work, the news. They do not know how to say, "I have been struggling, and I do not know why." Research from the American Institute for Boys and Men, published in 2025, found something striking. When men and women are asked broad questions about loneliness, their answers look almost identical. Similar levels, similar patterns, similar pain. But when you go deeper, when you ask specifically about belonging, about feeling irrelevant, about having a place in the world, men score dramatically worse. The loneliness is there. It is just buried, under years of practice, at pretending it is not. There is also a structural problem. As men age, the natural places where male friendship happens, school, sports teams, shared housing, disappear. And unlike women, who studies show are more likely to actively maintain and rebuild social networks, many men simply watch those connections fade without knowing how to replace them. By their 40s, many European men have one person they would call in a genuine crisis, their partner. And if that relationship ends, or if they never had one, they are left with almost nothing. Loneliness is not just emotional suffering. Your body experiences it as a physical threat. And the science on this is unambiguous. In 2023, the World Health Organization formally declared loneliness a global public health concern, stating that its effects on human health are comparable to smoking 15 cigarettes a day. Not a metaphor, a measured, clinical comparison. The science is unambiguous. Men are dying from this, but the consequences extend far beyond the general. A landmark study published in the UK Biobank, following over 500,000 people across 9 years, found something that is difficult to read. For men specifically, living alone, without emotional support, more than doubles the risk of death by suicide. Not increases slightly, doubles. Loneliness and social isolation, according to research published in the Journal of Affective Disorders, in 2024, are associated with a nearly 5-fold increase in risk of suicide mortality. And the effect is substantially higher in younger adults. Cardiovascular disease, weakened immune function, accelerated cognitive decline. The body of a chronically lonely man does not just feel worse, it ages faster, breaks down sooner, and gives up earlier. And perhaps, most devastating of all, lonely people are less likely to seek help. The very condition that is harming them also convinces them that nobody wants to hear about it. A narrative interlude. Tell a composite story that puts a human face on the data. Move from psychological to physical. This is where the stakes become life and death. Let us call him Thomas. He is 41. He lives in Hamburg. When Thomas was 22, he had a group. University friends. They went everywhere together. When one of them was struggling, the others noticed. When he was 30, the group had scattered. Different cities, different lives. They still had a WhatsApp chat, messages every few weeks, reactions to news, the illusion of closeness. At 38, Thomas started working from home. His office social life, which had replaced the university social life, disappeared overnight. He told himself he preferred it. He was more productive. He had more time. What he did not notice, because it happened so gradually that there was no single moment he could point to, was that weeks were passing without a single real conversation. Not a surface-level check-in, a real one, where someone asked how he actually was and waited for the answer. Thomas is not in crisis. He goes to the gym. He does his job well. He is, by every external measure, fine. But ask him when he last felt truly known by another person, and he will have to think for a very long time. There are millions of Thomases across Europe, and the tragedy is not just that they are suffering. It is that nobody around them can tell. The research on what actually reverses male loneliness is consistent and perhaps surprising in its simplicity. It is not therapy, though therapy can help. It is not apps or dating or self-improvement programs. What the data shows repeatedly across multiple studies is this: men form and maintain deep bonds through shared activity, not through direct emotional conversation, through doing things together over time, walking, building something, playing sport, cooking, watching a game. The activity is almost irrelevant. What matters is regularity. Showing up to the same place with the same people, week after week. That is how trust forms in men. Slowly, through repetition, through showing up. The United Kingdom appointed the world's first minister for loneliness in 2018. Since then, community programs across Europe have found something important. The most effective interventions for men are not the ones that ask them to talk about feelings. They are the ones that give men something to do together, consistently, without pressure. Men's sheds, community spaces where men build and repair things together, have spread to over 15 European countries. Participants report not just reduced loneliness, but improved physical health, better sleep, and a renewed sense of purpose. The connection was always there. It just needed somewhere to happen. Nobody is going to fix this for you. Not a government program, not an algorithm, not this video. But here is what 30 years of research on human connection tells us. The single most effective thing a lonely person can do is reach out to someone. Not to talk about loneliness, not to have a profound conversation, but just to suggest doing something, anything, together. A walk, a coffee, watching a match. The format does not matter. The showing up does. If something in this video felt familiar, if you recognized Thomas or recognized yourself in him, then you already know what to do. The message is already half written. You have already thought of the person. You have probably deleted it once or twice already this week. Send it. This was Entropy. We document what breaks down and why it matters. If this video said something you needed to hear, share it with one person, not for the channel, because that person might need it more than you do.